I was an LPN when I was hired at Poudre Valley Hospital in 1979, and I had submitted my application to Mary Sweet, who I think was like a one-person HR department. And she had called me one afternoon and said, "Cheryl, this is Mary Sweet. Are you still interested in working at Poudre Valley Hospital?" I said, "Sure am." She said, "Well, can you start tonight?" And I said, "You bet, I can start tonight, not a problem."
My orientation was basically looking through the supplies and the monitors, and a little different than now that people get, I think, about 12 weeks of orientation, and this was maybe 2 days.
They told me to report up to a unit. It was as simple as that. Went up to the unit, introduced myself, and hooked up with one of the nurses there, and that's how orientation kind of went. There was nothing very formal with orientation when I first started at the hospital.
I've had several different jobs as I have started out as a young thing, and you want the adrenaline going, but that sort of died off after about 12 years. And then you have just different interests or needs, and I was able to meet them being here.
I feel like in my career of the 40 years that I've been here now, I've been very blessed to be able to work in such an intimate way with our patients and families and with the staff, creating the friendships that I've had and being able to maintain a specialty such as oncology.
As a lifelong learner, just always wanting to know more, I've done numerous different certifications in different nursing specialties also, because I just feel like the more that you know, the better you are in your profession, and we continue to add value to those who are coming in our generations that follow us.
It's also very rewarding when you are in the grocery line at a grocery store and you hear your name being yelled, and you look up and it's like, oh my gosh, there's that patient, or there's that family that I took care of 3 years ago who still remember my name, and they're wanting to say hello to me and coming back to say, hey, thank you so much.
Well, staying is because we walk our talk and we keep true to our vision. We respect and we have that integrity, and so for a healthcare system, those are powerful pieces for me, for some place that I want to work. I want to be a part of that.
And it will be hard, for 45 years being here, is to actually sometime I'm going to probably retire.
And what I'm really proud of is our values. As an organization, we really do, I think, concentrate on having patients first. That is our priority. The integrity. If you don't have integrity, we're not able to do all of the other things that we do as an organization. And we all have a focus on excellence. And so we live our mission, vision, and values every single day at work in ways that we might not even recognize as we're touching other people.
A piece of advice for people who are wanting to have a long career in healthcare is to recognize how important it is to work in an organization that has been successful.
Knowing that UCHealth, in our system, is one of the best in the nation is something to be very proud of, and to have gratitude to be part of this. The number one thing is, if you do the right thing for the right reasons and you keep the patients number one first, you'll do great.
Connecting with each other in relations, strong teams, who are your team members on your unit, get to know them on a personal level even, because that makes you all a better group of people, the best you can be, and you bring it every day.
Really understanding why you are doing what you're doing. Don't lose sight of that why, the purpose that drives you to do what you do every day, and not get distracted by all the noise of healthcare. There are a lot of distractions around us in every department in the industry, and it would be easy to lose focus. But I think if you really stay true to the purpose, your why, you do what you do every single day, you can center yourself, be intentional, stay grounded, and you will always feel like your cup is half full and not half empty.